All right, welcome everyone to our Maya Move special Zoom meeting for those who would like to learn a little bit more about enlarged tonsils and adenoids and palatal expansion. How are those two related? What you can do for your own children. If you are a parent who you have been told by a different provider, guys, make sure you're muted, okay? You've been told by a different provider that your child has enlarged tonsils and adenoids, and you're kind of wondering, well, what may cause those? Or if you noticeably see that your child doesn't have enough room for their teeth. If they're a child, they need to be touching if they're really young. And then if they don't, sorry, if they are really young, they cannot be touched and they have to have spaces in between. So it's like a picket fence, a tooth and a space, a tooth and a space, a tooth and a space. After they lose their baby teeth and they get their permanent teeth, if there were no spaces before, they're going to be crooked for sure. So you can tell very early on if a child is going to need braces. So, okay, if you have a child with all primary or baby teeth and they don't have any spaces, it's already a red flag. If you have a child who is older, has permanent teeth, and they are already crooked, it's another red flag. So we're going to talk about how those can be related. How does having enlarged tonsils and adenoids can impact craniofacial growth and the amount of room that patients have for their teeth, therefore their tongue. I do want this to be super interactive. I want you guys to ask questions. You can type them in the chat box. You can unmute yourself. You can turn your camera on. However, this is going to be recorded and shared publicly. So if you do not want to be seen, just make sure that you just type your questions right here. I also have some questions coming in on Instagram that I'll have my Instagram open right here so I can answer those. But let me give you guys a little bit of an intro. So we have an idea of what we're going to be talking about. So here we go. All right, can you guys see my screen? Very good. So we're going to talk a little bit. I'm not going to go through the presentation. This is a 3-hour presentation probably. The red flags of myofunctional disorders, what you need to know. So this is going to be an overview of myofunctional disorders, the red flags, and the importance of early identification and referral for optimal health and development. This lecture that I did is for professionals. So even though I'm going to share the same slides, I'm going to break it down a little bit more to you guys so it's easy to understand. Pretty much, what are myofunctional disorders? They are issues with the muscles and the function of those muscles when it comes to the oral facial muscles. So muscles for the cheeks, the lips, the throat muscles, the tongue. So if those muscles are weak or they are not functioning properly, it can be considered a myofunctional disorder. These disorders can affect what are the functions that we do, right, with our face? So chewing, swallowing, breathing, and speech. And if they are left unaddressed, they can lead to significant health and developmental changes or challenges. However, I'm not a speech pathologist. I don't deal with speech. So I always refer out if somebody has any speech issues. I love this photo. I think it was by Dr. Patrick McEwen, maybe. I'm not sure. Maybe it was Joss that did this photo. I can't remember who did it. But the top photo, you can kind of see how somebody is supposed to grow. We are supposed to have wider jaws, a more squared face, our lips always closed. Have your eyes where you can see the upper side of your eyeball more than the lower side of your eyeball. But why? Why do some of us don't develop like that and we develop more like the lower one? The way that we develop, yes, it is very genetic. So we're supposed to look like our parents. However, if for some reason, let me explain that. We are supposed to look like our family. you cannot change somebody's genetic uh, pattern of growth. What is that? If somebody is more likely to have a long face like me, you can't all of a sudden make them grow this way by doing some of the changes we're going to talk about. You can't. So if you're already likely to have a longer face, you're likely to have issues that a person with a longer face has. If you're more likely to have a wider face, because that's where you're, whoever you look like in your family, right, looks like, then I can't make that person all of a sudden grow a long face. Okay. So you cannot change that those genetics and that pattern of growth. What can you change? Things that influence that growth. What are some things that can influence that growth? I will talk about the eyes real quick, and then we'll go back to what influences craniofacial growth. This is one of my favorite patients, and I'm so glad for every patient out there that lets me share their photos. I actually don't feel like I don't want to see anybody. Like, if you don't let me share your photos, I do not want to treat you, because part of what I'm doing is planting seeds, and it's getting out there to show everybody that there are answers to some of the things that they are experiencing. And myofunctional therapy, it's a lot of work. The airway journey, it's a lot of work. And I feel like after we get some great results, if I can't share that with anybody to plant seeds with other families that can be helped, I'm like, oh my goodness, this is almost wasted, you know? I understand privacy and all of that, and some people don't want their stuff shared, but we have other therapists that can treat you. I just want all my patients to, be out there, because the whole point is to help other people. How can what I'm doing not only help my patients, but help more people know about this and they can go look for help? It's about helping everybody that has no idea about this. Okay. So the eyes, I love this patient. He came to me 5 years old. And do you guys see the white sclera underneath the eyes? So that white portion, if your child looks like this and he has where you can see the lower part of the eye is more visible than the upper side of the eyeball, there's a couple indications. One, the tongue is too low, and we need to make sure that the tongue is all the way up there on the roof of the mouth, because it's going to support this craniofacial growth. This is 4 sessions, guys. It was probably every 2 weeks that I saw him, but look what happened in 4 sessions. How did that all of a sudden change? It's because now the tongue is huge and it's so powerful, right? And it's applying pressure, light pressure to the roof of the mouth, which makes all of those sutures that we have in our head kind of go back to where they're supposed to be, give stability to your orofacial system, which is going to impact your whole body. But I love looking at patients' eyes. Just by looking at patients' eyes, we can have a lot of information about what may be happening to that child. So this is a red flag that we look for. This child was taking melatonin every night to go to sleep, wet in the bed every night, taking a whole hour to go to sleep, waking up throughout the night, and exhausted during the day, and not listening at school, extremely hyper. In 4 sessions, all of that is gone. No more melatonin, sleeping through the night, no more bedwetting, and sleeping within minutes without melatonin. So it is huge how we can help these kids. And he's feeling better. So then behavior is going to be better. In school, he's listening to the teachers better, Therapy, he's doing better. These are just my mentors. Not just my mentors, they're really, really big. They're actually both passed away. First one is Dr. Tom Colquitt, and the second one is Dr. Martha Cortez. I love them dearly. I miss them, and I would not be where I am today without them. So I do like to honor them when I speak. This is just to show you how important the movements of the tongue is. The tongue is moving all day long, all the time. How can we talk about improving the function of other muscles that don't even move as much as the tongue moves? So this is somebody speaking, and it's funny because if you look at people speaking in different languages, the tongue will move differently. In this image, whenever I'm looking, since we're talking about enlarged tonsils and adenoids, it's right up here where I would look if the adenoids are enlarged. And this tube right here, the airway tube back here, needs to be free and clear. I know that these scans are of people whenever they're awake and they're standing up. It's different whenever you're asleep and laying down. However, it gives us an idea of what's happening. So I'll explain to you guys briefly. So this is the tongue. Now the patient is swallowing, is eating. Okay, so there's the tongue, and this right here moving is a soft palate and the uvula. So that little dangly thing that you see all the way back there. So we actually work on all these muscles. We work on the lip muscles, we work on the tongue, all of these muscles underneath the tongue, helping the tongue move, and the soft palate and the uvula also. We work on all those muscles to improve your function. So what are some of the things that could influence orofacial growth? So the first one is breathing. Breathing through your nose and breathing through your mouth are two very different things. Are we allowed to breathe through our mouth? Is it normal and accepted for us to breathe through our mouth? Yes. However, it is not okay for us to breathe through our mouth when we are supposed to be nasal breathing. When are we able to mouth breathe? We're able to mouth breathe when we swim, when we're talking, when you're eating. You should keep your lips closed. But it's a rescue breathing. So you can only breathe through your mouth whenever you're not able for some reason to breathe through your nose. Every single other time, you should be breathing through your nose. For high intensity workout, Patrick McEwen teaches that 40% of the time it's okay. So the first photo is actually a photo of Zoe. Whenever I saw this photo, I almost fell backwards. Like, oh my gosh, I'm a myofunctional therapist and you can see her tongue. That is not a tongue thrust. That is actually healthy and a nasal breather's mouth where she's missing teeth and the tongue is actually applying pressure. She was about 7 years old, I think, at the time, applying pressure to the structures so they grow. And then the lower photo is the problem. So if your child looks like this, of course, this is an open bite. But what I'm looking for the most in this photo is that the tongue is low. Why is the tongue low? Because that patient cannot breathe through their nose. Then we keep getting deeper and deeper. Why can they not breathe through their nose? So is it because they have enlarged tonsils and adenoids? Okay, why do they have enlarged tonsils and adenoids? Is it because they have allergies? Is it because they're eating dairy, gluten, sugar, processed foods? Those are huge. Is it because their maxilla is too small? I don't believe mouth breathing causes enlarged tonsils and adenoids. I believe that it makes it worse because if you think about it, whenever you breathe through your nose is like a filter. It's your body's natural filter. So think about an air conditioning filter. When all of the pathogens go through there, these areas in the nose are supposed to catch all those pathogens and not let it attack your body. Whenever you breathe through your mouth first, everything goes straight into your tonsils and it attacks your body immediately. That's when, we see kids get sick all the time. If your child has had tubes in the ears, difficulty or choking a lot when they started eating food, different than gagging. If they had tons of tonsils, what is it called? Strep throat. Those are all signs that there's a lot of mouth breathing going on and your body's natural filter is not working. There are 6 filtration systems in the nose. The tonsils are the adenoids and the tonsils are the last ones. So they go through several of them. So if those are enlarged, think about an air conditioning filter that is completely full. They have not changed it in a year. Is it really working? Is it filtering anything at that point? So if your child has insane enlarged tonsils and adenoids, I know that we as parents, we do not want to do surgery. Of course, I'm a parent before I'm a therapist, but they're not working. So we do have to try everything. And most of you guys that follow me, including myself, we're all crunchy. So we're going to find more holistic things to do, more preventive things to do. So I can tell you guys in this talk, or we can do another Zoom to go over specifically things that you can do to try to reduce tonsils and adenoids. You guys can tell me in the comments if you want me to go through those. But let's look at some other things that can affect your craniofacial growth, or myofunctional therapy addresses also. So their tongue functions. Breathing is a tongue function. Sucking is a tongue function. So of course you start as a baby by breastfeeding or bottle feeding. So the tongue mobility is essential for effective sucking. It enables the coordinated movements needed to create suction, maintain a seal, and rhythmically drop milk or liquid into the mouth. I just interviewed an IBCLC for Airway Circle or for Beauty of Breathing. It's going to be on the podcast. So if you guys are not following the podcast, please do. On the podcast this week or last week, and she said that breast milk, your hormones produce breast milk for the first 16 to 22 weeks after the baby's born. After that, a lot of moms run out of milk, and you guys can tell me if you're one of those that like milk just went away after some time. And people are like, okay, now we got to do formula because the milk went away. A lot of times, not every time, a lot of times when the baby is not strong enough to suck, successful enough, toned up enough, using those muscles properly, being able to breathe well through the nose, they are not going to be successful in draining that breast and getting the milk out. And guess what? You're only going to keep producing breast milk if the baby is able to empty the breast. So they have to be able to take the milk out in order for the body to produce more. If they cannot breastfeed successfully, we do see things like that. We talk about chewing. That's also a tongue function, which will also impact craniofacial growth. So back in the day, we didn't cook food, right? We were chewing very, very hard things. And if you look at skulls from years and years and years ago, everybody had room for all 32 teeth, including wisdom teeth. Why are we growing smaller faces now? And chewing is one of the culprits. So mouth breathing is one, low muscle tone. So this muscle is not working properly. And then chewing is another reason. So nowadays, I mean, think about what your kids like to eat. One of the questions that I have on my questionnaire as a myofunctional therapist is, what are your child's favorite foods? And a lot of times they'll see things like chicken nuggets, peanut butter and jelly, chicken fingers and French fries. Those are all foods that don't require a lot of chewing. And you're going to notice that if either a child has a tongue tie, they have crooked teeth, they have enlarged tonsils or enlarged adenoids, they will choose those foods that are easier to chew and swallow, that break down easily. If something takes a long time, so some fibrous foods, some vegetables that are hard to break down, steak that takes a lot of chewing, they get super tired. So that's your body just trying to conserve energy. You do those things without knowing you're doing those things. So they kind of, oh, I don't like it, or I try to avoid. I've actually had a patient who was 4 years old who decided to be a vegetarian, but it was because they had such a hard time eating. They convinced themselves that it was super young. I was like, this is so weird. Convinced themselves they did not want to eat meat. Not sure what else was involved in the decision, but we have to look at the patient's abilities and skills to be able to break down food. It is essential for somebody to be healthy. We're constantly talking about, we talk about vaccines, we talk about nutrition, we talk about exercise, we talk about screens, we talk about all of these things that could influence a child's health, but we're not talking enough about chewing hard foods, being able to breathe through the nose when it's natural and normal for everybody to breathe through their nose. Why can't we? So chewing is one, and then of course swallowing is another tongue function that, if not done properly, your digestion starts in the mouth. If you're not able to break down the food and swallow properly, all of a sudden digestion doesn't start correctly. So all of the enzymes, everything that is supposed to be released by your body to help break down food, to be able to get the nutrients from the food, all of that is going to be impacted in a negative way. I like to say that 80% of your immunity is in your gut. Your mouth and your gut are connected by a tube. It's, up and down. When the amount of bacteria, so your gut flora and your oral flora, are affected, you're affected. So if this one is affected, that one is affected. Does that make sense? If we have unhealthy gums and bacteria in our mouth, that are not great for us, it's going to affect your gut flora, and vice versa. There are several things that we eat that can impact also negatively impact our gut flora. 80% of immunity is in the gut flora. Allergens. A lot of people who are allergic to peanuts. I heard that if you breathe in through your mouth and things go straight to your tonsils, it attacks you. All of a sudden, your body is not producing the correct bacteria and enzymes to tell that certain things are not good for you, if I'm explaining that correctly. There was a Netflix show once that I watched about, was a documentary, scientific documentary about kids who have allergies. If anybody remembers, write it down here and remind me if I'm saying this correctly. But when pathogens go in through your nose first, your body then produces this, I can't remember if they were enzymes or bacteria, I think were bacteria, to tell that these substances were safe for your body. And the increase in allergies were because everything was coming into the mouth, going straight to the body, and you did not have this process of having it go through your filtration systems and your body accepting, oh, that came to the nose, we clean out, it's fine, we're not going to be allergic to that. And it had something to do with the peanut allergies also. I'm gonna have to go look it up. If you guys remember, please message me. But anyway, so very, very important for us to be able to breathe well through the nose, chew our food correctly, and swallow correctly. These are functions that are essential for your body to function. We don't talk about them enough, but I am here to try to increase awareness on normal bodily functions that we should be doing them correctly, and a lot of us are not. So I am going to probably stop right here. Speech, yes, I don't do speech. We talk about our rest posture where your tongue is supposed to rest, but I'm not going to go through the rest of this presentation. I am going to stop my share right now and open it up for questions. I know that I just gave a brief history about myofunctional therapy. So let's go. First question. I'm going to go through the chat right here. My 4-year-old has confirmed enlarged adenoids and tonsils, and ENT wants to do surgery. She breathes only out of her mouth. I would love an alternative to surgery. Would palatal expansion be the answer? Okay, great question. So I always tell everybody that I'm a mother before I am a therapist. So I would never recommend surgery first for anybody. However, we need to kind of like draw the line. When is surgery needed first versus not? So with the way that I think to myself and talk to my patients, of course, I can't make the decision for you. It's between you and the surgeon. However, the way that I like to think about it, if the child has sleep apnea, so if they're gasping for air at night, you can visibly see that they're, not able to breathe well at night, or they have a sleep study. And you can do sleep studies in little ones. I like to use True Sleep Diagnostics. He's a friend of mine, Ken Hooks. He's out of Greenville, South Carolina, but he will send your machine to your home, and you can do it with young kids if you want to get an at-home sleep study. Or you can talk to your doctor and they can guide you for an in-lab or somebody else who can help you. So, number one, the child has sleep apnea. And the tonsils and the adenoids are 60% or more enlarged. That's usually when I say, let's go ahead with surgery, because the impact that every single night, this child going to sleep and having 18% less oxygen to the brain, depending on how bad their sleep apnea is, I don't want to take that risk because it's brain damage what is brain damage? It's hypoxia, lack of oxygen to the brain. Think about when you're trying to sleep and for some reason the tonsils and the adenoids, something is blocking your airway, your tongue falls back, something blocks the airway. So this is obstructive sleep apnea, not central, okay? Central sleep apnea, your body tells you to stop breathing. It's not due to something that's in the way, it's neurological. So obstructive sleep apnea, there is an obstruction somewhere, and all of a sudden the patient is choking. That's what it is. And think about you being underwater a little bit too long. It's very detrimental to your body. So all of your body starts, a siren starts going off if you can't breathe. So it impacts every single system in your body. A lot of these kids will wet the bed. Why? Because they can't breathe. Think about you being underneath water a little too long, and all you need is to survive. All you need is to take your next breath. Your body releases everything that's not important. We don't care about anything else, including pee right now. Everything needs to leave. And we have to use all of our forces to be able to take the next breath. This is not the scientific explanation why they bet wet. There are 3 or 4 different theories out there. I'm not sure if there's a proven one. But pretty much an easy way to think about it is your body has to release everything that's not important. When somebody has a heart attack, sometimes they pee on themselves. When somebody is held at gunpoint, a lot of times they pee on themselves. But it's pretty much your sympathetic system going, which is fight or flight. Your sympathetic system is that fight or flight. You have 3: parasympathetic, rest and digest, fight or flight, and then you have also freeze, something in freeze. And those are probably the freeze ones, when you're like, you don't know what to do. You're so scared and your body just shuts down and it releases. So that's one of the explanations.
Renata, thank you so much for answering my question. So the ENT said that she has a 75% blockage in her adenoids. And as the snoring, sometimes she does snore and sometimes she doesn't snore. So it's kind of on and off.
Okay, number 1, are we doing a nasal hygiene every night?
No.
Okay, so that's the first thing we're going to start. And I recommend to all of my patients, nasal hygiene, nasal hygiene, nasal hygiene. We have to make sure that we're clearing and cleaning the passages as well as we can so that patient can breathe well through the nose.
So is that like a saline?
Yes, you can do just regular saline. You can do, there are several different nasal sprays out there. There are some that are medicated, some that are not medicated. Did the ENT recommend Flonase?
They did, but I'm scared to give her Flonase only because it's a steroid and I don't want to thin out her tissues because I have history of EDS, so connective tissue disorder. I don't want to thin out her tissue.
Okay, so that is something definitely you need to talk to your provider about, somebody who understands more about EDS. However, Flonase is usually the first thing that they recommend for enlarged tonsils or enlarged adenoids.
I'm sorry, I'm just picking up my children. I'm sorry for the noise.
It's okay. You can mute yourself and I'll finish answering. Okay. So EDS, Ehlers-Danlos syndrome. We're not going to go into hypermobility here, but it's very, very common. Well, it's not very common. There's different degrees. I'm not going to go into it because I'm not an expert in it, but we're seeing more and more in our patients, I should say. And we got to take those into consideration. So 75% or more blocked. You don't want to do Flonase. I would definitely try to speak to somebody because Flonase is not going to be done. I'm not a doctor. I cannot recommend medication. But Flonase is not going to be used for more than 3 months. Usually, from my experience, the ENTs that treat my patients recommend 2 to 3 months of Flonase. And however, if it is allergies, you're going to find out in 2 weeks. If it starts working. I have patients who the children were bedwetting, they started Flonase and they completely stopped. So if that's the issue, if it's an allergy, then Flonase is going to work. At least that gives you an answer. So you don't have to use it for a long time. But if it's something that your ENT or your doctor has recommended, if it's my children, I would use it for some time if it's safe for your child to see if they are going to respond to it. Because if they don't respond to it, then we're going to have to look at other things. So the first thing that we need to look at, it's starting nasal hygiene. 2, reduce any allergen that you can. Carpets, rugs, too many stuffed animals, hypoallergenic sheets. So remove anything from the room that could be collecting dust. And then toxins. So whatever you clean in your house, cleaning products from your house, make sure it's all toxin free, all, healthier for them to breathe. If you have any plugins that smell good on the wall, any type of fragrance, guys, it can be your laundry detergent. It can be lotions, perfume, anything that smells good, candles sometimes. So all of those things.
Yes, we don't use any fragrances because I'm very sensitive to chemicals
Good.
and fragrances in my house. As far as rugs, I'm all the way there. You know, I clean, vacuum, no rugs, everything organic, cotton, and all of that stuff. As far as I know, she doesn't have any allergies. I think that it's purely a structural issue because these are all
Could
the
be.
problems that I might have had. So I have a tongue tie, narrow high palate, you know, all of these problems. So I think it's purely genetic. And I'm just scared to put her through surgery if it's completely unnecessary.
Um, Surgery at times, unfortunately, is necessary. However, I would make all those recommendations first. I know that there are more kids over here that have enlarged tonsils and adenoids, and you guys are looking for answers. So I'm just going to talk in a general sense. If you're already doing these things, great, you're halfway there. Make sure that you check your house for mold. They could be getting exposed to mold in schools. So if it's purely structural, guess what? They need a palatal expansion. There's only one research that shows reduction in tonsils and adenoids, and that is rapid palatal expansion, not slow. Depends on the age of the child. They're going to move a little bit faster with older kids, a little bit slower with younger kids. However, I like to fix expander, something that they cannot remove, and there's going to be a little key and they turn. Turning once a week, it's more slow. Turning twice a day is more fast. So there are tons of different options in the middle. It also depends what kind of screw they have, because sometimes depending on the screw, if you turn once is the same as turning twice with another screw. So again, I'm not an orthodontist. I'm not going to go into that. But if the problem is structural, then we're going to do palatal expansion. However, there's something systemically usually that's screaming on that child saying, you know, there's inflammation. So if we've already done all the things that I recommended, have you removed, and you don't have to answer, but because this is a question for everybody, have you removed dairy? Did it work? Have you removed gluten? Did it work? Have you removed sugar and processed foods? I'm a mom. My kids have Nutella sandwiches. Benny does sometimes. So I know that you cannot live in this bubble where they're absolutely 100% super healthy, because even the healthy food sometimes is not that healthy anymore in the US. However, if you do not want to go through surgery, you can try all those things. Okay, Renata, my child is 2, 3, or 4 years old and they have enlarged adenoids. What do I do? Unfortunately, very few pediatric dentists and orthodontists are trained in expanding them that little. If you're willing to, you don't want surgery and you're willing to travel, that's what I recommend. If you want to find a provider that's closer to you, go to airwaycircle.com, click on directory, and see if you can find somebody. It's just a list of providers who are trained. However, you still need to interview those providers, make sure that everything that they put on there is accurate. Look how crooked my nose is. Oh my gosh, it looks super crooked right now. And I've had deviated septum correction. Anyways, so that's what I would do. If it's a 4-year-old who has enlarged tonsils and adenoids, they need palatal expansion, I would start nasal hygiene, do all of those things that are recommended, and then palatal expansion if you can find somebody. Flonase, if you can do it, if it's what's recommended, to my children by the ENT, it's over the counter now. I would definitely do that because it's not going to be long term. Steroids are not to be done long term. Is to find out, is this an allergy? If we find out, yes, Flonase worked, it's an allergy, let's go to an allergist. Or you can just go ahead and go to an allergist first, get an allergy panel, get a skin test done, find out exactly what's bothering that child. Sometimes you're not going to be able to remove them. For example, I found out I was extremely allergic to crepe myrtles. It's a type of tree that's super common where I live, and there were 9 of them in my yard. What am I going to do? So there are certain things that you can do to improve. However, breathing through the nose by itself will improve the allergies. Myofunctional therapy is very limited when somebody has 75% blockage on their adenoids, because I'm teaching that child how to keep the tongue up. They're not going to be able to. I'm going to have to do other things. So we're really going to focus on gut health, on working with other providers, on tons of nasal breathing things. But as far as tongue position, I can't really do much of that. Somebody had turned on their camera. Are you ready to ask your question?
Renata,
Hi.
I'm so
Oh,
sorry.
go ahead.
Just one last question. Why
Yes.
do you prefer the rapid palate expansion over the slower?
Because what I want done is for the suture to open. So your palate has its two bones, maxilla bone. There are two bones with a suture in the middle. You need a certain amount of force to reopen that suture. If you apply little force, guess what's going to happen? The teeth are going to move. I don't want the teeth to move. If you go a little bit harder, the suture is going to open. For all of these patients who have enlarged tonsils and adenoids, enlarged adenoids specifically, or enlarged turbinates, which are the spongy structures that you can see all the way, pink structures that you can see all the way inside your nose when you look in there. If those are swollen, you're only going to get nasal changes if you open the suture. So you want to get a space in between your teeth whenever you're doing palatal expansion. A lot of these slow moving appliances will move the teeth within, it's called the alveolar bone that houses the teeth. This bone right here that houses the teeth. But what I want is this bone to move. I want this bone to move, not the teeth within this bone. That's why I like rapid more. Go ahead, whoever had their camera on.
Oh, yes. Can you hear me?
Yes.
Oh, great. Okay. So my son, he's about 5.5. We have been working on his tonsils and adenoids for probably the last 2 years. I took him to an ENT 2 years ago because he kept getting ear infections. He was just always woke up grouchy, never woke up in a good mood, had like dark under his eyes. And so I've taken him to lots of naturopathic doctors. Everything you said was spot on. Like, we buy all organic fruits and grass-fed meats and free-range chicken. And we actually have our own, we have like 35 chickens here at home. So
Wow.
I do all those things, like the non-toxic everything. I don't give my kids seed oils or dyes, all that. And so basically I've been taking him to naturopath, and I'm like, I want to see, let's try working within, because something's making those inflamed. And so we did a stool and a blood test, and it came back that he's gluten intolerant. So for the last year, and because we noticed, because it would come out in like his skin, he would get these like bumps on like his cheeks, like tiny bumps.
So important. Skin issues. If your child has eczema, if your child has any skin issues, it's so important to look at the gut. There is something that your body is not accepting, and it's going to come out on your skin.
Yes, or he got his toenails became fungus. And so ever since he went gluten-free, and we've been very good about, we got this fungus stuff from Sprouts, we put that on every night, but ever since we went gluten-free, 3 of his toenails are back to normal. And so basically, and then recently we've gone to a myotherapist for about probably the last 6 months. We see her once or twice a month. And I do feel like it's starting to help. He does go to a more holistic dentist.
What's your question?
Sorry, I'm like going on and on, but it's because I've done so much over the past 2 years to try to help him, and know that like I've done everything I can before surgery. So basically my question is, we have a cousin who did the palatal expansion, because we just went to an orthodontist. She recommends top and bottom palatal expansion. Because it's just the adenoids that are swollen now, not the tonsils anymore.
Amazing.
And my cousin did it, but once the palatal expansion came out, it went back to normal. And I'm like, I don't want to put him through that if it goes back to normal, you know?
Okay. So of course I have not seen your cousin or your child, so it's hard for me to say exactly what it was. I'm not going to know. However, when somebody relapses, meaning they had palatal expansion done and the teeth move back, a lot of times that was only alveolar bone movement. So whenever, oh, that's a cute puppy. Whenever they moved the teeth, it was either too slow or it was braces expansion or Invisalign expansion to just move the teeth within that bone. And also it could have been because he still couldn't breathe through his nose because that was not addressed. And they still did not have myofunctional therapy. If your tongue is not strong enough to stay up there, it's going to collapse again. If you cannot breathe well through your nose, it's going to collapse again. So all three pillars need to be addressed. If you only address one or two of them, the patient will always relapse. You have your hand raised. Go ahead.
Oh yes, because also I she's done. I can go for her because I wanted to ask also about my son. Similar issues, but we had surgery already.
Good,
we had
okay.
adenoid surgery. Yeah, I can wait for.
No, go ahead. Tell me. So how old is your child?
He's 6, and
6 years
since he
old?
was,
And you guys had
he's 6
tonsils
years
and
old.
adenoids removed?
Only adenoid.
Only adenoids at what age?
Last year, so he was 5.
Perfect. What kind of improvements did you notice right away?
He stopped snoring for a couple of months, but he's snoring again, especially since spring came back. Spring came again. I mean, he has allergies. We don't know which ones yet, except for the nut allergies. He reacted to is it called Indian nut? Is it called Indian nut or cashew nut? Cashew nut. Cashew nut.
Okay.
Yeah,
Cashew.
and yeah, he had the swollen tongue, and after that, all these problems started when he was 2 or 3. He had the allergic reaction to the cashew nut, and after that, all these issues with tonsils, and that's my timeline started. That's what I've noticed. Before that, I mean, well, there are a couple of things. He wasn't breastfed because he couldn't latch on. The lady that came to assist, whatever, the nurse that came at home, she told me that it was my fault, that my nipples are normal. I mean, they're not
Come
small.
on, people. There are so many things that will impact breastfeeding. I actually had 2 IBCLCs also come and help me with Zoe, and both of them said that they were tie savvy. Both of them checked Zoe, never looked at the lip. Both of them missed. Both of them told me lies. It's kind of insane. And one of them, y'all, reeked in cigarette smoke. How do you let somebody who's so bad with cigarette smoke hold your newborn? I was freaking out. Anyways, what is your question?
Exactly. Yeah. So better to see your face. I think it's easier for when we're talking. Yeah. So I was trying and he started to latch on, but then it's a whole story. But anyways, the first time they gave him to me, he did latch on. The next day, maybe because they gave him a bottle at the hospital, maybe that's why I don't know. Something happened, and so then he had the pacifier. That's the worst thing I could have done, but I had no idea. Okay. Honestly,
it's okay. You did the best that you could. So your question is, he's still snoring now.
I didn't know any better. Yeah. Yeah, and so I tried many natural things you can imagine for 2.5 years. And after that, he had many ear infections. I mean, he had pain in the ear. They weren't that.
Okay, yes. Let me answer because there's so many questions. We have less than 10 minutes left. For the sake of time.
Reduced hearing. Yes. Okay.
For the sake of time, you've done all this things.
I'm writing everything down.
Okay, what can I do? So
and he's snoring again. Yes, and now we're doing the myofunctional and mouth taping with the one that is open. The one that no, we shouldn't. We started
snoring.
Recently,
I wouldn't do mouth tape if he's snoring. Are you doing myofunctional therapy?
No, not yet.
Have you guys done palatal expansion?
No.
Okay, first step, make an appointment with a myofunctional therapist. It doesn't have to be me. Okay. You guys can go on airwaycircle.com and find someone to help you. But after looking at his specific case, I'll be able to tell you exactly, let's do either palatal expansion first or let's do myofunctional therapy first, or let's do something else based on exactly his case. So let's schedule, if you guys want to know specifically about your child, let's schedule a guidance call. Guidance call is 30 minutes, $50 with me that I can go over the whole case. More specifically, I like to keep the questions for this that's going to be in the public eye more general, because many patients are going through exactly the same thing that you are going through with your children. I'm going to answer just a couple more questions. I have about 9 minutes left. Let's see. My son, 6-year-old, had an adenoid surgery and has, oh, that's you. Okay, has ear tubes due to ear infections, but his tonsils are still enlarged. We have started using the myomunchie and mouth taping. I would not do that. His lower teeth are crowded. That tells me he needs palatal expansion immediately. But one is growing behind the other. 100%. Those are called shark teeth when the permanent teeth are behind the baby teeth. Still snores and sometimes has difficulty breathing during sleep. 100%. So the myofunctional therapy, guys, and some people that you're gonna find out there, myofunctional therapists just give you a list of exercises. That's not really what myofunctional therapy is, especially with MyoMoves and any of my students that have taken my courses. We are like an airway consultant. Okay, 40% of my patients that come to me that do guidance calls don't need myofunctional therapy. And I'm not going to sit you there and tell you to start if I feel like your child needs something else. So we help you decide, because we know this is extremely overwhelming as a parent. It is so much information. Half of the providers that you're going to see are going to fight you on this. They're not going to want to do anything. One, we have relationships with providers who are in this world and will listen to you. So we can help guide you step by step. Okay, now we're going to do this. Now we're going to do that. So let's find a chiropractor. Let's do reflex integration. Let's see a physical therapist. Depending on what it is with each case, we are going to be able to help you, every single step of the way. Even if you're not even ready for myofunctional therapy, but you just want a little bit of a guidance, that's what the guidance call is for. If you're ready to start, it's a full evaluation. You guys can go on the website, is www.myo-moves.com. And you can schedule yourselves. We have our online scheduler tool that has the appointments available there. Or you can, and I need to give it away, right? I did a giveaway this weekend, but I haven't pulled out the name yet. I need to pull the name. One person is going to get a free myofunctional therapy evaluation, which is $400, an hour and a half. Let's see what else. That was me. And then that makes sense, since my daughter has Down syndrome and has low tone, still affected her ability to nurse well or long enough. I keep hearing that RPE tips the teeth and doesn't help. That's wrong. Helps the airway. For a 13-year-old and 32-year-old that needs it, I really want to do RPE, but nervous. What are your thoughts? Thank you. RPE does not move the teeth. What moves the teeth is the speed in which they move the appliance. So they're trying to get away from calling rapid versus slow, just calling it palatal expansion, because it's going to depend on how much force they put in. Like I said, the screws and the amount of turns. A 13-year-old is not going to be the same as a 32-year-old. There are many people who are extremely constricted and they already need a MARPE. MARPE is what I had done. If you guys have not seen my highlights, please run over to Beauty of Breathing and look for MARPE and my palatal expansion story, or you can go on the highlights on Instagram and I have everything on there. So it's an appliance that actually places screws on the roof of the mouth. So it goes right here and right here on either side of the suture. And whenever you turn, the screws are applying pressure for this to open. If the appliance is attached to the teeth, you have to move a lot faster to be able to get the suture to open. Otherwise, the teeth are just going to tip. My son was diagnosed with enlarged adenoids at 7, and we tried sprays, breathing techniques, and they're still enlarged now at 9 years old. ENT tells his breathing at 35% and wants to remove them. I want to see an ortho myofunctional in my area, and she said it's not a mouth issue. His palate is slightly smaller by 1 millimeter. It's an adenoid issue. I did an oximetry test, and that is fine too. He's constantly congested, so that's usually a turbinate issue, which could be still a palate issue, because the roof of your mouth is the floor of your nose, the same structure. If you have a nasal issue, you could have a palate issue. Now, if he's big over here and everything is fine, growing properly, but he still can't breathe well, then let's look at allergies. So did you do allergy tests? You did sprays. I'm not sure if you did Flonase, but I would love to see an allergy test. Make sure you remove carpet. If he has carpet in his room, it's worth paying the money to get the carpet removed, y'all. It has completely changed my life to not have carpet for 15 years. And then I just moved to a house that has carpet. Benny, my 5-year-old, will say, Mommy, my nose is not working like Zoe's. My nose is not working. And I had an allergy spray. It was not Flonase, it's something else, Nasacort, I think. I had that I brought from Brazil. And he was like, I want that spray. That makes me breathe again. Like, he is already so aware, of course, because I drill it into his head. But it's crazy how aware these kids are and how it makes them feel better. But I can already tell, just because I have carpet, my breathing and his breathing has already been affected.
And Renata, something that I got from my son's naturopath that seems to have helped him, he's been having his mouth closed for the past month while sleeping, is the trace mineral powder. It's the NAC powder that helps with mucus buildup. That has really, really helped him.
Thank you so much. If you have a link, you can put it in the chat box. It will be incredible. But
okay.
Of course, guys, if you guys haven't met a naturopath or a functional medicine doctor, I highly recommend it. I don't like doing blood work on kids because I'm scared of needles. But if your child, of course, is super underdeveloped, malnourished, we're going to have to go there. I stopped doing rinses because he bleeds often. That's the nose. And also got blood in his ears. It hurts him. Thinking of maybe it's best to do the surgery. He's also very active in sports. He's going to get better if you get him out. I'm just worried about relapse and other issues after surgery. I also released his tongue tie at birth. He did an allergy test already and nothing came back, because there's 2 different allergy tests you can do. You can do the one that's for environmental things, or you can do the food one. With Benny, I messed up. I didn't go. His nanny took him, and they did the food ones, and they told me everything that I already knew. But with the environmental one, it's very, very important. If there's anything in there that you can remove, great. There's also something that you guys can do, and it's if it's environmental. Sorry, I see something in front of my house and I lost my train of thought. If somebody is allergic to something, remember that you cannot remove allergy drops. So they used to do allergy shots. There's a lot of ENTs or allergists doing allergy drops right now, which of course they gather everything the child's allergic to. They make little drops and slowly introduce that, and they start getting used to it. That can help. Local honey. I mean, we have heard tons of things. Thank you for posting the link. I see it right here. Do your kids take this well? Because my kids don't like anything.
Yes, it's a watermelon flavor. The other flavors don't taste very well, but they just made a watermelon flavor, which is, the kids love it. They ask for it every day.
Awesome. I'm totally going to try it on my kids. Thank you. Last question. Who's it going to be?
Hi, do you hear me?
Yes, I do. Yes. And just a reminder, everybody who is speaking or showing themselves live, this is going to be public. Reach out to me if you're a part of this so you can sign my consent. Go ahead.
So I was the one that just wrote about my son that was just with the allergy test. So that's what kind of started me on this journey, was because I noticed he kept being congested when he was around dogs or outside. So I went to go do what's called a scratch test, which try to go through everything, the seasonal allergies, dogs, food, and everything came back fine. But that's why my hunch is like there's still something. So that's when I went to an ENT and discovered that on my own, because no doctor was listening to me with his mouth being open and always dry around his mouth when he would breastfeed. They were like, oh no, it's just because of the rubbing of the breastfeed, the breastfeeding, but it was always like dry. His lips were peeling all the time. So I did all of that, and now that's it. We're at the point of the surgery. So you're saying it's going to make a huge difference with the surgery, right? Like since I've done everything else.
If his breathing is at 35%, I would love to see a CBCT on him. So
What's that?
I would love to see a CBCT on him. It's a 3D X-ray that usually the orthodontist will take. That will
Yeah, we
show
did
me.
that.
I would love to see it. Let's do a guidance call. You guys,
Okay, perfect.
maybe it's super easy. You guys can also text 47.
Well, I've done one with you already 2 years ago when I started the journey. Yeah, but wait, I didn't show you the test. I didn't show you the test because that just happened now.
So let's do it. Let's do a follow-up so I can
okay.
help you guide. Now that you have the answers, I can help you guide.
Perfect. Thank you.
Help guide you. You're welcome. This is amazing. Thank you guys. Did y'all enjoy this? Should I do this more often? I have a couple more announcements.
Yes, you should. We love it. Thank you.
You're welcome. All right, couple more announcements. For everybody who is here live and you guys schedule by the end of the day, either your guidance call or your full evaluation, I'm going to send you guys a gift. I have, let me take a screenshot of everybody who is here live so my team can get it. Okay, perfect. Announcement number 1. Announcement number 2. I am starting something. It's a project, and I'm wondering if you guys are interested in this. The link to get more information is going to be in my stories. Make sure that whenever you get any of the emails, mark them as safe, put them in your inbox so it doesn't keep going to spam. I am going to do group myofunctional awareness classes. This is not myofunctional therapy. Let me make that very clear. Not myofunctional therapy. For me to do myofunctional therapy, I need to do a full evaluation and I need to see the children and give individual exercises. However, I am going to offer a program of 12 meetings for patients who cannot afford a full program. So this is going to be very well discounted. Who cannot afford a full program and you want to have your children join, everybody's together. And I will do one exercise once a week every time that we meet. Maybe 2 exercises, I'll think about it. And then you guys just practice that at home. Keep it in mind that it's not individualized. So if somebody cannot do the exercise, it's a problem. They have to be able to do it correctly in order for us to get good results. So if you guys are interested in this, keep an eye out in my stories, or I'll probably also have the link in my bio where you guys can join the wait list for the first cohort, the first class that's going to have access to this group myofunctional awareness program. Thank you guys so much for being here. I hope you enjoyed it. I'll go back to Instagram and answer some more questions over there. But please don't hesitate to reach out to us. We are here to help you. We're here to help you breathe better, sleep better. And we just want to see your kids grow and thrive. Thank you so much. Mwah. Have a great
Renata,
day. Yes.
One last question. You said that if we schedule the one-on-one evaluation, is that a full price? And you said you'll be sending a gift with that, or is that a discounted price?
So I will do, if you guys want to do a guidance call, I'll send you a gift. If you guys want to do the full evaluation, first, I'll give you $50 off and send you the gift. How about that?
Okay, perfect. And that'll come out into our email?
Yes. So you guys can just go ahead and schedule, and I have your list right here. I'm going to give it to my assistant, and they will make sure that if you are on the schedule, that they give you the discount and send you the gift.
Thank you.
Thank you guys so much. Mwah. Bye.